My name is Dr. Sira Owibingire. I'm a lecturer in Tanzania. I work at the Muhimbili University of Health and Allied Sciences, which is the main training in medical sciences in Tanzania. Being a lecturer, but at the same time a surgeon at the National Hospital, I treat a lot of cases with head and neck cancer. And when I got the announcement that Merck Foundation is announcing for oncology research fellowship in India, I found that it's the best undertaking I can take in my scholarship. So I'm here as a fellowship trainee in oncology research in my basic area, which is head and neck surgery. So I'll combine the training in clinical and research. So most of the part will be at the main hospital and other part will be at the ACTREC, which is Advanced Center of Research in Cancer. Briefly, if you would say of head and neck cancer, majority will be oral and pharyngeal carcinoma. And worldwide, India is #1 number of incidences of such cases. But when you see number of patients who are treated in India, majority are treated at Tata. So I found myself to be at the main, I would rather say, a site where anyone would dream of. If you want to learn about head and neck cancer, you come to Tata Memorial Center. Cancer incidences in Tanzania, as it is in other low income countries, is now rising. So it's a threat, I would say. And for example, in Tanzania, if you take the cases which are treated from 2012 up to 2016, there was like a 50% increase. And in Tanzania, we have mainly one cancer dedicated center, which is called the Ocean Road Cancer Institute. Patients who are treated also at the National Hospital surgically, but once they need chemotherapy and radiotherapy, they have to be taken to that cancer hospital. We have 4 zonal referral hospitals which are trying to start treating cancer also. 2 at an advanced stage, they are starting cancer services soon or maybe this year, and the other 2 they will be starting in the near future. So the biggest challenge in Tanzania, number of cases are increasing, but at the same time there are hardly enough human resource in treatment of cancer. If you are to talk of medical oncologists, clinical oncologists are there, not enough, but surgical oncologists are very, very few. For example, in my area, head and neck, maybe we have one dedicated ENT surgeon who takes care. The rest of cases are being handled by just any other surgeon. So we need to see how we can improve on oncology research. Okay, when you want to embark on effective treatment of cancer, you need to go by evidence-based treatment. You don't just say this and these cases can be treated effectively. So cancer treatment goes with the research. I like the way they are doing it here at Tata. They are treating patients, at the same time they are doing enough research. So at times they say we can embark on doing 2, 3, 4 because it is useful to the patient and because we have researched on this. So at our place, research in cancer is lacking. And when it comes to my area of head and neck, I would say there isn't much being done on that. So my training here will help me and the university and the hospital and the training programs in Tanzania to embark on treatment, effective treatment of cancer through dedication in getting evidences that such and such undertaking will be of much help to the patient. And this is through research. I'll be also be of use in the training programs, because we do train head and neck general surgeons in head and neck, we do train ENT surgeons, we train oral maxillofacial surgeons. They need a very good portion of oncology in their training, so I'll be very useful in our trainings. But when we sit as a panel of surgeons and oncologists discussing a case, you need to have someone who has at least seen the best practice in a place like Tata. So when I go home with such knowledge in clinical care and research, I'll be having cutting edge information, I'll be having a certain level of authority to talk among the fellow panelists, among the fellow oncologists and surgeons when we are discussing on cases, on challenging cases in their panel during tumor board and the like. So this is in a nutshell to be of use to me, the training program, but also to the patient's care. So up to now, I've covered the area on the clinical care of patients, the basic practice in the aspect of surgery, the care they're giving the patients prior surgery and after surgery, the care of pain. Pain goes with, cancer goes with pain, so that area of palliation and pain management. And from here, I'll also go to the issues of lab methods which are appropriate to head and neck cancer. I've done part of it and I'm going to complete part of it. From there also, I'll go now further on the area of research in terms of epidemiology and preventive care at ACTREC. So when you talk of cancer research, I'm going back to it. When you talk of cancer research and care, you need also to go far beyond that. You need to talk on the area of prevention. Currently, there could be much. MEX is helping African in the treatment, the training on that part of treatment and research. If there could be something being done on embarking on preventive programs, just to mention a few: breast cancer preventive programs, awareness campaigns, cervical cancer. These are two cancers killing a lot of women in Africa. When you come to men, lung cancer and prostate cancer, if you can do a test for the 4 types of cancer in Africa, of course, don't forget my main area of oral and pharyngeal carcinoma. Something can be done also. But what I'm saying here, you train a surgeon or medical oncologist, you save some lives, few lives. If you embark on an extensive awareness campaign and preventive program, you prevent so many lives. Having said that, maybe thank very much Merck Foundation for this training. I thank very much for them envisioning that we need to have Africa included in the prevention, training, and research of cancer. And I also thank Tata for the best environment and the best people that provided for us for the best program in cancer training fellowship. Thank you very much.